Hello everyone. For some people, school is just around the corner, maybe starting in a couple weeks. When I first started podiatry school, I had not taken any anatomy or physiology courses in undergrad. Starting anatomy course for the first time, it was a little difficult to adjust because I didn't know what was expected, what was going to be on the exam. I hope that by making this video, I can give you guys a brief intro to anatomy so that you guys are not lost from the get-go. Number one, let's define the purpose of anatomy. So in anatomy, you will be dissecting through cadavers, which are pretty much dead people, and you will be looking through different layers of muscles. You'll be looking at different nerves, arteries, vein. You will be looking at bones, organs, and everything in between. You'll also be looking at the brain, spinal cord, So that's anatomy. Basically, have to be well versed in the whole human anatomy. Number two, at the beginning of your anatomy course, you'll be learning words that can help you describe the location of what it is you're talking about. So really learn these words, make sure you use it in your daily vocabulary so that you can really understand and appropriately use these words when you describe, anatomy. So these words could be medial or lateral, it can be proximal or distal, and it can be deep or superficial. So don't worry if you don't know these words right now, because you will be introduced to them, and I just want you guys to keep in mind that these are very descriptive words that's used to describe anatomy. Number three, so before the start of your dissection lab, your professor will give you a dissection guide that you can probably read a day before or a week before, whatever the case. And these are good guides that can help you understand what it is that you're going to be dissecting on that day and what muscles you're looking for, what arteries you're looking for. These are most likely instructions written by your professor. On the day of the dissection, it is very likely that your professor will come over to your table and be questioning you on what it is you're doing. So it's good to know what you're doing and be able to answer some of their questions so that they see that you're doing work and you can feel good about it. Number four, one of the most common terms used throughout maybe the first and second lab would be terms like superficial fascia and deep fascia. Now, don't worry if you've never heard of those terms before, because I never heard of it during my first lab and I felt lost because of that. So these are just terms to use to describe fat and the deep connective tissue. So the fat would be called superficial fascia, and the deep connective tissue, which is a white layer sheet, that's called deep fascia, which is covering the muscles. So when you dissect through the skin, you will enter the superficial fascia. When you cut deeper, you will enter the deep fascia. So it's just something to keep in mind, and just some terminology that you can use throughout the lab, saying, oh, I just cut to the layer of superficial fascia. Oh, I just cut to the layer of deep fascia. Number five. So if you've ever seen pictures of anatomy, and how the artery travels, the vein travels, the nerve travels, it looks like they're going in a straight line, and you would think that those structures have a singular name. But in reality, when a certain artery travels from here to here, they have certain names that go along with each segment. So keep in mind that arteries, veins, and nerves, they change names as they go from proximal to distal. Okay, so that's something to keep in mind. And what you should also keep in mind is where they change the name. What structure do they pass that changes the name? Okay, now we're going to the muscles. Muscles, they have an origin, they have an insertion, they have an artery supply, and they have nerve supplies. And based on the insertion of the muscle on the bone, they have certain kind of function. So these are something to keep in mind as you are dissecting. See what artery is nearby, see what nerve is nearby, and those are most likely going to be supplying the muscle to help it perform its function. So biceps Flexion, right? Flexion. Triceps, extension, extension. Okay, sounds good. This is perhaps the eighth tip. Now, skeletons are located throughout anatomy lab. They are for you to observe, they are for you to touch, and what you will notice is that most of the bone is smooth, but there are some parts where it's just elevated, right? Rigid and stuff like that. So why is that? Well, maybe that's the insertion for muscles. They are called landmarks. Okay, these landmarks tell you where these bones insert. Okay, so let's take deltoid, our deltoid muscle right here, for example. It inserts into a deltoid tuberosity, right? Now, what happens is that when your muscle contracts, it leads to shoulder abduction, abduction. So it goes like this, boom, right? Boom. Contraction, because it's inserted here, it's gonna pull here, right? It's gonna pull on this location, pull, pull, pull. So that's something you should know, because landmarks are definitely testable information. Now, my ninth tip for you guys is to look up mnemonics if something seems very difficult to remember. So for example, there's a mnemonic for the brachial plexus. Like I said, remember when different like nerves travel, their names change, right? As they go from proximal to distal, their names change. So there are easy ways, or easy mnemonics for you guys to remember. Just look it up. You guys will be able to find it. If anything else seems difficult in the anatomy course, just make sure look up mnemonics. See if there are easier ways to memorize certain structures, certain pathways, and stuff like that. Okay? Best of luck. Oh, one last thing. So on the exam, pretty much anything is testable. Like I said, the landmarks on the bone, they are testable. The arteries and nerves that supply the muscle, they're testable. You should keep in mind that muscles have origins and insertions, and they are also testable. So everything that you do in lab, you should really be very mindful. You should be reviewing from day one. Hopefully the tips that I've given you guys will get you through at least through exam 1, because usually that's the most difficult exam, because no one knows what they're doing, what they're memorizing, what the purpose is. So once you get through the exam 1, exam 2, and exam 3, they will become significantly easier because you know what your professor's asking for. Hopefully this helps, and I'll see you guys next time.